Medical Terminology course with Dr. Liver. Medical terminology means the study of terms. In terminology, a term may reduce an entire phrase to a single word, like gastroduodenostomy, which means communication between the stomach and the first part of the small intestine. It helps you to guess the meaning of new words. For example, dermatitis. If we break it down to its part, the suffix itis means inflammation and the root derma means skin. The word means inflammation of the skin. Neurology. If we break it down, the suffix logy means the study of and neur means nerve. The word means the study of the nerve system. Neuritis. We have the suffix itis, which means inflammation, and neur, which means nerve. It means inflammation of the nerve. And by knowing the meaning of roots, suffixes, and prefixes, you will guess the meaning of many new words. Words are divided into two parts, constructed and non-constructed. Non-constructed words are usually eponyms. Eponyms are terms derived from the name of people or places. Other terms are derived from languages other than Greek or Latin, like jaundice, which means the yellowing of skin, is derived from a French word. Most words in terminology falls into the other category. Words are constructed from word parts such as roots, suffixes, and prefixes, and their origin is Latin and Greek. A word may be constructed from a word root, which gives the primary meaning of the word, a suffix that is used to modify the word root and it is fixed at the end, and a prefix which is also used to modify the word root fixed at the beginning of a word. Roots in terminology are based on these two languages, Latin and Greek, and are meant to be used in combinations. For example, the word cardia. In Greek, it means heart, and it gives the root cardi. Sometimes two roots, one from Greek and one from Latin, refer to the same structure. The Greek root nefer and the Latin root rin, both are used to refer to the kidneys. As a general rule, Latin roots are used to name anatomical structures and Greek roots are used to name diseases, conditions, diagnosis, and treatment. Same root can have a different meaning in different fields of study, so sometimes you have to understand the context of a word before assigning it its meaning. Like the root sigler, which means heart but also refers to the white of the eye. When constructing a medical word, you can put the root with a suffix, a prefix, or both. There is also compound words that contain more than one root. For example, urogenital, which contain more than one root, and it refers to the urinary and reproductive system. You can simply add a suffix to a word root if the suffix starts with a vowel. If not, you have to add a vowel between the root and the suffix. There should be a vowel between them. Like neurology, because the suffix logy does not start with the vowel, we add O. Mostly the combining vowel is O, but there's also A, I, and E. A root with a combining vowel is called a combining form. When adding two roots together, you need a combining vowel like cardiovascular and gastroenteritis. Although enter begins with a vowel, it also needs a combining vowel. Like we are making a compound word with gaster and enter, and then we are adding the itis in order for the suffix to refer to the both organs. So it means the inflammation of both the stomach and small intestine. Gaster is the stomach, enter is the small intestine, and itis is inflammation. After giving a small introduction to medical terminology, I think the best way to study it is to study the terminology of each system separately, and I will make a video of the terminology of each system.